What's up everyone, Dr. Greg here with another episode of Braces Explained. And today what I wanted to talk about were the 6 things that I want you to know about before starting any aligner therapy, including Invisalign. Okay? So the first thing I wanted to talk to you about was the fact that Invisalign is not the only clear aligner on the market. Just like Klenex is the only type of tissue on the market, but it's just the name that's branded and everyone thinks that that is the only type of aligner. So what a aligner is basically a series of trays, which are clear pieces of plastic that you wear that move your teeth from one point to another. So as long as you incrementally keep changing these trays, your teeth follow along and get to the end destination. The way these are made is that they're digitally set up, and you have a different tooth setup in each set, and you print them out using 3D printing. And what you'll do is you'll melt down plastic on top of this, trim around it, and then polish it, and you'll deliver these series of trays, and you'll wear them for any amount of time that your orthodontist recommends. Which moves me to the second point. Before you start any aligner therapy, realize that this isn't some magic fix. It's still going to require help from you to wear. Since you're not having braces on, you're going to have something else that delivers this force throughout the day. So with that being said, you're going to be needing to wear these trays anywhere between 20 to 22 hours per day. Because what it's like is that you're pushing a ball up a mountain. If you only push it for a little bit and let it go, it'll roll back down. So what you really have to do is keep pushing it and wear it as much as you can throughout the day. The only reason you should be taking off your aligners is to brush your teeth and to eat. And right after you finish doing those things, you should put them right back in. So this brings me to our third point, and this is the fact that Invisalign, not always, but usually will require attachments. What attachments are is that they're little filling-like material that is placed onto the tooth that adds a handlebar. So if you can ever imagine picking up a big wet glass slab, it's very hard to get a good grip on it, and that's exactly what the tooth is. It's a very smooth surface on there, and it's very hard for this plastic to wrap around the tooth. So what these attachments serve as is basically they serve as handles that can move the teeth in the trays and make sure that the one tooth isn't left behind. So they're placed differently by different orthodontists, but at the end of the day, when you're getting Invisalign, you should assume the fact that you're probably going to need several of these attachments. So moving on to the fourth point, these aligner therapies sometimes may require a procedure to be done called interproximal reduction, or IPR. So what IPR is basically taking down the fan-shaped appearance of a tooth and making it a little bit more slender to account for space that's not there. So if you have crowding, the way we can buy more space essentially is by thinning out the teeth on the top or on the bottom to allow for them to move and fit into the arch. It's generally quite painless, but it might cause some slight sensitivity, so it's something to be aware of. The fifth thing you should know about before starting Invisalign treatment or any clear aligner therapy is the fact that you may still need to wear rubber bands. Now if anyone had braces before, you'll remember what the rubber bands are, extending from your upper teeth and your lower teeth, basically to get your arches coordinated. The same thing has to be done with Invisalign. We can make it so that your upper arch is all straight and your lower arch is all straight, but with any aligner therapy or Invisalign, what you would have to do is make it so that they coordinate. So this would require you to wear some rubber bands, and your dentist and orthodontist can let you know about that before you get started. They'll give you a little bit of foresight. They might not always know that until we go midway through, which brings me to my last point. When you go through the trays and you see on the box how many trays you have to have until you're completed, that may not be the end. What we are doing with these aligners is we basically are getting the ball into the park and getting it as close as we can, but a lot of the times, and I would say most of the times, we have to do something called a mid-course revision or a mid-course reevaluation. At this point we take a pause, look at the teeth again, either reuse an intraoral scanner or take an impression, and at this point we might have to reevaluate the need for more aligners. So just because the box or the bag says that you'll be done after 15 or 20 aligners, it may not be the case. To get you to perfection, it would take us to get 15 to 20 aligners to get you into the right area and a little bit more to refine it and take it to perfection. And that's pretty much it. If there's any questions you guys may have about any aligner therapy, please let me know in the comments below. If you like this video or this series, please subscribe and follow my channel. Thank you, and I look forward to seeing you guys again on another video. Dr. Greg.